Okay, so welcome back again after a short tea break. Now we are going to talk about the very important part. It's physiotherapy in spinal muscular atrophy. Um, so what are the exercises? I mean, it's a commonly asked question amongst all the therapists and even the parents that what should we do to make our child more functional. So let's go through the small presentation. So the physiotherapists have two major roles to play in the management of spinal muscular atrophy. The first being regular assessments. So and the second is intervention. So what is the assessment? Most of you have come to a physiotherapist for some of the other assessments. It's a mandatory thing once in 6 months. So what do we do? So we do the regular motor assessments. Why? For the first thing is why they are important. They are important to know the functional status of the child. So depending on the age of the child and the type of SMA, we know that the child has different functional abilities. So there are standardized assessment scales which are giving us some score, and that score is helping the doctor to decide the dosage of the medication. Even we know how is the progression of the disease. So regular assessments are absolutely essential. That's the first part of the physiotherapy role. So I request all of the parents make sure that you get child assessed on a regular basis. So these are the
May I request all the parents to remain seated, and if we can maintain a bit of silence so that the talk is audible. Thank you. Thank you, ma'am. Go ahead.
So I request all the parents to make sure that you get your child assessed on a regular basis. So these are the few assessment scales. These are the standardized assessment scales for SMA. So again, as I told you, that depending on the age and the functional ability of the child, we are assessing the child on different domains, and then we get a score. So this is a summary score sheet, how it look like. It always has a previous score with the date, so that the doctor, mainly the pediatric neurologist, they will come to know how is the progression of the disease. Is there any improvement of the scores, or there is a deterioration, or is the same? So how is the child progressing? So as you can see, there is a mention about spine, hamstring muscles, TA, contractures, any contracture. So that also is a very important aspect to know how the child is progressing. As we know that SMA is a progressive disease, so we have to know how the child is progressing. And depending on the scores, the doctor will decide about the dosage of the medication, or what line of treatment can we start. So this is about the assessment. Then comes the intervention. So what comes in the intervention? These are the goals of intervention. The first thing is the muscle flexibility. As you all know that the muscle has to have some optimal flexibility or the length to operate. If the muscle becomes tight, obviously my functional capacity is going to definitely reduce. So obtaining the muscle length is a very, very important goal in the children with SMA. Then it's very important to maintain the lung health and improve the energy levels. Chest care becomes very important. Many of the previous speakers or doctors have emphasized on the lung complications and how we have to take care. So physiotherapy also becomes very, very important to maintain the lung health and the lung capacity. Then comes the posture. A good posture is a prerequisite for good movements. It's that we all know. So it has to be the posture has to be given a maximum priority because it's a muscle. The SMA is a muscular, neuromuscular disease. The muscles are going to get very, very weak over the time. So what will happen? It can cause the deformities. We just heard how scoliosis is treated and scoliosis is managed. So before going to that level, how you keep the child, whether it is SMA1 or it is SMA2, the posture where your child is taking, like maximum maybe in the sitting. So it's very, very important to take care of the posture, and the maximum alignment has to be achieved. Then the assistive devices, bracing and splints. Mr. Sarvanan is going to talk in detail about it, but it's again very important to keep the joints at the optimal positions, hence preventing the contractures. And even the mobility aids, sometimes the mobility devices, when the patient has lost the ambulation, the mobility devices also help to keep the child or the adult mobile. Then the functional training. Functional training, it includes the gross motor, fine motor and balance training. It is helping the overall mobility and the functional independence. And regular physical activity. So we have to keep the child as physically active as possible. We heard in the morning about the joint and bone health. So we know the physical activity is going to improve the calcium deposition and the bones are going to become strong. So the physical activity becomes a very, very important aspect of the physiotherapy management. So now the very important topic, what is not allowed in SMA. So these are the few things what we always recommend that not to do in SMA. The first thing is no to weight trainings. Any weight training with dumbbells or free weights or resistant bands, it is not to be encouraged. For a very simple reason, because it's a progressive disease and the muscle physiology is not normal. It's a neuromuscular disease. The muscle is already very, very weak. So usually in the usual muscle, when the muscle becomes weak, the physiotherapist gives strengthening exercises. That's a common thing. But in SMA, because the physiology of the muscle is also not that well, they don't have that much of contractile tissue remaining. So we cannot strengthen the muscle by giving external weights. So that is very, very important. Then second thing is avoid repetitive heavy muscle work. Heavy muscle work is like going up and down the stairs 50 times or maybe squatting for 100 times. So many of the parents, they come from all over India and they are going to some physiotherapist and they are taking physiotherapy for 2 to 3 hours at a stretch in a day. So that is definitely not recommended and it should not be done, because finally what we are going to get is tremendous muscle weakness. The muscle is going to get fatigued more. It is not the normal muscle which can increase the strength by strengthening exercises. And there are a lot of queries whether to follow this video or that video, and there are a lot of things on Google. So I will request, do not practice anything, any exercise regime from any online videos. Talk to an expert, because every child is different, every child is special. So we have to see, I have to talk to the team, I have to talk to all the doctors. Depending on the condition, we have to program the physiotherapy for that particular child. So just looking at some video and practicing it at home is definitely not advisable. So what are the do's in SMA then? So exercise only up to the child's energy limit. The child will tell when he's getting tired. As we know that they have respiratory muscle weakness also, they don't have that much of lung capacity, they don't have that much cardiac capacity. So too much exercises are definitely not advisable. Then stretches, very, very important. I tell all the parents whether it is SMA1 or it is SMA4, the stretching is always advised. Keep your joints flexible, because the joints, if the maximum length, the optimal length, muscle length is there, then only functionally you can use that muscle. Then use the assistive devices as recommended. Then encourage physical independence in ADLs. So there are children and or the young adults. So you have to make them little confident that yes, you can also do, you can also perform. So giving them the maximum functional independence is very, very important. It is from the psychological perspective also that you make the child, try to make the child independent. And promote play as much as possible, because again, these are all young children. They are not able to understand what is happening to them. There are so many things happening in their body, and they are just talking, you are taking them to the doctors and this assessment, that assessment, and sometimes ICU and all. So the first thing you have to understand that they are children. So promote play as much as possible. So play with the child. That will also give a lot of physical activity. So what is allowed? So these are the things which are allowed. Like you can practice yoga, you can practice swimming, you can practice aerobic, depending on the obviously the functional level of the child. But you can encourage these things, and even cycling. Therapy should be, it has to be goal-based, it has to be pain-free, it has to be play-based, and it has to be holistic. As I told, it should not give a lot of pain also, because it's a child, then they will not comply to the therapy regimes. So it has to be goal-based, so what goal we have to achieve. Pain-free, I just explained. The play-based, again I explained that these are the children, so you have to have a lot of play activities with the children with some physical activity, so that the child gets motivated to perform with you. And it has to be a holistic approach, because we are talking about the multidisciplinary team. Even the therapy, I mean, I have to ask about the therapy planning for each and every child, so that it becomes holistic. We have discussed, we have learned many things from Dr. Eileen in the morning about the respiratory care. So these are the small pointers again I want to highlight. Why the respiratory care is needed. The physiotherapy, why it is needed, because to prevent the lung infections. In cases of infection, we are helping to clear the airways, because the cough is very, very weak. So the patients are not able to cough that effectively. So we are helping them to clear the airways and to improve the lung capacity. Whatever lung capacity the child has, we have to maintain and improve it if it is possible. Then what has to be done? So what we do from the chest physiotherapy perspective, what we do is we give a lot of postural drainage positionings. Then we give the expiratory techniques like vibrations or percussion on the rib cage, coughing, huffing, so that we are assisting again the patient to cough out, and it will assist the airway clearance. And then the regular breathing exercise. We give a lot of breathing exercise, including the exercises to improve the chest expansion and upper mobility exercises, so that we can maintain the lung capacity or to improve the lung capacity. What is not recommended is the incentive spirometer, because it is proven to be causing a lot of pressure on the muscles, and SMA is again, the children are very, very weak, so we cannot recommend incentive spirometer in them. So again, it's a gist of the whole thing. What do I do with SMA1 children? Regular stretches, correct positioning, chest care, and bracing if required. If it is SMA2, it is regular stretches, correct positioning, chest care, orthosis, and using of standing frames. So if the child is able to stand with support, we can give use of standing frame. It's very, very important to make the child stand. The physiological standing improves the bone health. And in SMA 3 and 4, regular stretches, use of orthosis, functional training, because these children are ambulant, so we can start thinking of functional training, ADL training, gait training, and of course the chest care, again it becomes an important thing. So this is the last quote: medicine adds days to life, physiotherapy adds life to days. Thank you.
Thank you so much, ma'am. Instead, now may I request Mrs. Bhavna, who is also a pediatric physiotherapist, and she's the mother of a kid with SMA. I request her to present this memento to Ms. Gauri.
Thank you, Ms. Gauri. Our physiotherapists are the backbone. So thank you for doing that, for many of the things that we do.